Okay, it's being set up. Zahraa, you can hear me, right?
I can still hear you.
Okay, perfect. It's being set up. It's just loading. Okay, so we are live now. Um, we are hosting our Back to School series by SMILE. This is our second session. We're hosting this to have a conversation about the concerns raised by SMILE families with returning to school during COVID-19. The goal of this series is to discuss the different aspects that parents and caregivers need to consider before sending their child back to school by having conversations with local leaders, educators, parents, teachers, and professionals. I just want to make sure, can everybody hear me? Okay. I'm just making sure with our team that the live, everybody can hear me and there are no issues. Okay, I think we are good. So let's get back into it. The reason for having this series is that we have never faced a situation like this. We're living in a pandemic and it's unprecedented times. We can't remember a time like this in our living memory. Many of us don't know what to decide or how to navigate through the given health guidelines in order to keep our families safe while our children transition back into the schooling system after 6 months. We may not have all the answers, but our goal right now is to use our platform to bring you different perspectives from parents, local leaders, and educators on returning to school during this pandemic. My name is Zahraa, and I'm the case coordinator for SMILE. I'm also a public health student, and today our conversation is with Zahraa, who's a public health professional. Zahraa, why don't you tell us a bit about yourself?
Sure. So it's a pleasure to join you all here today. And Sada, it's an absolute pleasure to be working with, a fellow public health, professional to be. My name is Zahraa Saab or Zahraa Saab, however you pronounce it. And I am a public health professional from Toronto, Ontario. I've worked with a number of different governments on developing policy recommendations, as well as United Nations officials, consulting agencies, research institutes. And my most latest project was a COVID-19 database of resources for Muslims in the GTA. I've also had the pleasure of working with fellow public health professionals on developing some materials for SMILE, which has just been an absolute amazing experience from start to finish. And yeah, as I said, it's an absolute pleasure to be here today with you guys.
Thank you so much for all the great work that you do for the community. I just wanted to put a disclaimer out there before we start with the panel questions. The disclaimer is that this is a general opinion of a public health professional. If you do require any specific medical assistance or expertise about your unique situation, please contact your health care provider as they'll be able to guide you the best in your situation. We also welcome any questions you may have. Please leave your questions in the comment section on our Facebook Live and we'll go through them at the end. So let's start with our general questions. So Zahraa, what are the various public health guidelines regarding returning to school in this September?
There's a lot of them, so brace yourself. But it's understandable, right? Because what we understand is that students are going back in two models, right? They're either going back to the conventional 5-day model, or they're going to, through an adapted model where it's 1 day on, 1 day off. And obviously that's different from elementary to high school students. Now, all of the government's advice has obviously been grounded in public health advice from the Office of the Chief Medical Officer of Health. And so that means that it's been based on two main things. Number one, that COVID spreads from person to person. And number two, that COVID spreads when we touch, surfaces or objects, right? So with that in mind, schools have been asked to develop a wide set of protocols. And I'm going to touch on them a bit. It will be a bit overwhelming, but I think it'll give you a good idea of how extensive these measures are going to be. So first of all, what we're going to see a lot of is pre-registration. meaning that schools are probably going to be reaching out to parents, some have already started doing so, and asking them to register their child and select what kind of model they want to opt their child into, right? And that's going to help parents and school members and teachers and school boards determine how many students are going to be in each class. And it's also going to help people make decisions for the upcoming fall in terms of their own personal situations. Are they going to, what's their workday going to look like? What are they going to have to do to ensure that their child is getting the education they need? The other thing that we're going to see a lot of is a lot of screening and COVID-19 self-assessments. So when the pandemic first started, a lot of us were using an online tool at a slight cough or a bit of a fever, which is the right thing to do, right? Now what's going to be asked of students and parents is to self-screen before coming into school. And so parents are going to be provided with a checklist of potential symptoms, and they're going to have to check their students or their children against these symptoms. Now, when kids show up at school, they might have to go through a second round of screening, which we would call active screening, perhaps a temperature check, perhaps they're going to be asked more questions. And, if they do exhibit any COVID-19 symptoms, they're going to be turned back. Another protocol that we're all very familiar with now is wearing non-medical face masks. We understand the importance of face masks, especially when individuals aren't able to keep a physical distance from each other. Now in schools, they are going to be making exceptions for individuals who aren't able to wear masks because of breathing difficulties or anything else. What we also know is that kids are going to get the chance to take off their masks during playtime outside or anytime in between class hours when they're permitted to be taken outside. Now, again, what we know is that kids are going to have to wear a face mask if they are in grade 4 and above, but if they're under grade 4, so grade 3 to kindergarten, for example, they won't have to wear the masks, but they're going to be encouraged to. So I know that's been causing a lot of anxiety for parents, but I think it's important to know the distinction in terms of what each age group is required to do. Now, something that, sometimes I feel like when I'm talking about public health guidelines, I'm like, this has all become norm. Like public health speak for us as individuals from the public health field has become the norm for everyone. And it I'm in so much awe to realize how people have adapted so quickly. And essentially everyone's become an infectious disease expert and a public health expert on their own, because everyone now knows the importance of physical distancing, the importance of hygiene, right? So what we're also going to see at schools is a lot more hygiene protocols and a lot of emphasis on respiratory etiquette. We're going to see a lot more hand washing stations around schools, a lot more hand rubs or alcohol-based rubs is what they're calling them now, all over the school as well. So there's going to be a lot of that. We're going to see a lot more physical distancing guidelines, and that's going to look very unique in schools because it means that, for example, lunch and recess, they're going to be happening at different times. Classrooms are going to be set up differently, right? We're used to one setup for classrooms, but they're going to look very different. We are going to be discouraging the sharing of materials, right? We tell students sharing is caring, share. And now all of a sudden we have to tell them, you can't share anything, unfortunately. We won't have large school gatherings anymore either. And there's going to be a lot of visual cues around the school. So it is going to be a bit of an adjustment, but again, it's nothing that we're not used to. There's also going to be a lot more enhanced cleaning and disinfection of schools. So highly touched surfaces are probably going to be cleaned twice daily. So things like doorknobs, light switches, desks even, and then even some of the outdoor equipment is going to be cleaned regularly, depending, like it's actually ranging from board to board. Some school boards are saying we're going to clean our equipment after each cohort has used it. Other boards are saying otherwise. So it's going to look very different, but the point is there's going to be a lot more disinfection. What we're also going to see is, and I don't know if students will like this necessarily, but a lot more rigor with attendance reporting, right? So that means schools are going to be keeping, they're going to be staying on top of their attendance files. who's coming in and out of the school. And the whole purpose of that is to support public health and contact tracing, meaning that if somebody does get COVID, we need to be able to link back that case to whoever else might potentially have it. And so schools are going to be asked to hand over those documents to public health units. Now, some other protocols that I won't go into too much that you are going to hear of for sure in the coming weeks is student transportation. That's going to look a lot different. If individuals get sick, like students or staff, it's also going to, there's going to be specific protocols for that. And then certain parts of the school might be completely cut off. So the cafeteria where we would hang out with our friends, it's no longer a place for us to come together, unfortunately. So it's definitely a new reality. There's definitely a lot of protocols. And hopefully the hope is that a lot of this will be communicated to parents in advance of the school year. And the teachers are going to be trained on this, and students are going to be very familiar with it as well.
That was a lot of information. Yeah, they're definitely taking a lot of these precautions and protocols to limit the spread. But the biggest question with these guidelines are that will these guidelines be sufficient for children at higher risk who may be immunocompromised with other vulnerabilities? That is one of the biggest questions we have. And can we expect to see more nurses at schools to ensure the safety of the children?
So to answer your first question, yes. I think we are expecting a lot more public health nurses and nurses in general to be at schools. From my understanding, the government's committed $50 million in order to onboard 500 nurses to help with implementing these public health guidelines and protocols in schools. What that's going to look like from school to school, it has yet to be seen, but we are going to, expect an increased nurse presence for sure. Now, as for children who are at higher risk and who have vulnerabilities, and whether or not these guidelines are sufficient, that's obviously not my call, and it would definitely be the call of parents, right? So parents know their children best. They understand the medical situation of their children. And so the best thing that they can potentially do is consult with their family physician and ask their physician, what is, seeing that these are my school's return to school plans, can my child return to school, or is it best that they stay home and do remote learning? So one of the good things is that students who can't come to school will have the option of doing online or distant learning, so remote learning. And students who can't do online remote learning and still need to show up to school, they're going to, especially if they're students who have specific needs and they need more one-on-one time with teachers, or teachers are the ones responsible for cleaning the students or helping the students. Those teachers are going to be wearing a lot of extra PPE. They're going to be, wearing not just your non-medical face mask, but most likely eye protection. If they're dealing with the children, they're going to also be wearing gloves. So, regardless of the situation, they're hoping, I'm assuming, for a smooth transition for children, regardless of their circumstances.
Yeah, that's very important, what you mentioned. So my next question for you, as you already mentioned about self-screening, and there's also another layer of screening at schools. As parents are required to do the self-screening, the first step, but what about children who exhibit any flu-like symptoms? They're supposed to be sent home as per the guidelines. But the main concern is that how can working parents of those children, particularly parents with children with special needs, adapt to these circumstances, since many parents work while their children are at school?
I have immense respect for parents of children with special needs, and I recognize that, previous to the pandemic, they were already facing so many challenges and obstacles and difficulties, and now the pandemic's come and it's exacerbated it all, right? It's become even harder for them to, new challenges have come up. It's been much more difficult. The reality is, yes, unfortunately, if your child does exhibit some flu-like symptoms, they're most likely going to be turned back for their safety, but also for the safety of other students. So the way, parents can prepare for this is twofold. If you're a working parent, I would highly advise you to look into your workplace, leave policies. So essentially, like, what do they say around sick leave? Are they granting you flexibility around, whether or not you have to step away from work for a day just to take your child for testing? So you can always check in with the Workplace Health and Safety Committee and ask them about this. And that will give you a good idea of how to pre-plan in the future. And also, just like schools are developing a supply list, it might be worth considering developing a close contact list of perhaps family members who you trust to take care of your children. In the case that, yes, you're at work, you get a call saying your child has to be sent home, and you realize, well, I can't take the day off and I can't take them to a testing center. Well, perhaps one of those close contacts can, right? So those are essentially, off the top of my head, 2 ways that parents could pre-plan. But obviously, this is going to depend on each child, each parent's circumstances, whether or not they even have family members that can offer them that kind of support, and what their workplace policy leave is like.
That's definitely going to be challenging, but those 2 strategies you mentioned are a great way to, be prepared in case there is, your child is sent back home. So my next question to you is, or you already mentioned that, the protocol is that, increase in hand washing and disinfecting, but who is exactly responsible for disinfecting mobility devices for children with special needs or any adaptive equipment during the school day? And who will be responsible for making sure that, the PPE or masks are actually being utilized by the kids, right?
Really, really good questions. So I've had the chance to peruse some of the school board's reopening plans. And I've also seen what a lot of disability associations have been calling for, and they've been asking very similar questions to this. Quite honestly, right now, it's not very clear from the provincial or school board plans who is going to be responsible for disinfecting mobility devices or adaptive equipment. However, what I've seen from provincial and school board plans, and even from a public health perspective, right? We know that teachers are going to have educational assistance on hand, especially teachers who are working with children who have special needs. They're going to, as I said, be provided with enhanced PPE in order to ensure that they are safe, but also that the students are as safe as possible. So even though this isn't included in the plans, I would assume that there will be some sort of role there for the teachers who are already doing so much for the students, right? And I'm sure they'd go the extra mile and do something like this. As for the PPE and things like masks, what we know is that school boards will be providing teachers with the masks and face shields if need be. And then students, parents, it's a mixture actually. So in some situations, schools have said that they're going to be providing students with non-medical face masks, but they've also said, parents can also purchase masks for their children, and children can bring those masks to school with them. So it's completely fine.
Okay. That sounds like a good plan, but the uncertainty with the mobility devices, that's what parents are really concerned about right now. So my next question is that, you mentioned that kids from between kindergarten and to grade 4, they're not required to wear masks, right? But how are we going to be sure that they're going to be taught age-appropriate ways of physical distancing and hand washing practices and other public health guidelines? What tips can we give to parents right now?
That's a great question. So kids, from what we understand, they're going to go through some trainings at the beginning of the school year where they're going to be taught how to wash their hands, how to properly cough and sneeze. What those trainings are going to look like, it might be different from school to school. It might be videos. It might be actual nurses coming in and teaching this to students. It might be teachers teaching this to students. So it's going to look very different. But what I would say to parents is, in preparation of sending your kid to school, it's always good to start practicing public health measures prior to the school year starting.
Sure.
So for example, start teaching your child how to wash their hands properly. Pull up a video off of YouTube, learn how to wash your hands properly as well. There's a proper method to do it. It's not, what we've all thought it was for the longest time. and make sure that you're teaching your child not just how to wash their hands, but when to wash their hands, so that it becomes a natural instinct for them to easily, after they've eaten, go and wash their hands. Before they eat, go and wash their hands. Because these are very pivotal and important moments when it comes to protecting yourself from COVID-19. As we said, it's spreading through person-to-person contact, but also through touching surfaces, right? So you have to teach your child, every time you've touched a surface at school, it might be contaminated, so go and make sure you wash your hands. Or also teach them how to use hand sanitizer. So you can prepare by putting sanitizer in their backpack, teaching them how to use it in the right amount. Obviously, we don't want children, spraying hand sanitizer at each other all the time. But at the same time, teaching them how to properly rub it on, how to use it. If you're going to be sending your child to school with a mask, it's also really important to prepare them from now. Children are not used to wearing face masks. None of us find face masks comfortable. I have yet to meet anyone who can, who says that they love face masks. And so it's really important to start practicing with your child, just because once they do get to school, they're going to be wearing it for many, many hours, right? And it's going to be uncomfortable and it's going to be itchy. And yes, they're going to have breaks in between, but it's good to start getting that habit started. I'd also say, they're going to go into school and they're going to see this place that they love and see as a second home. It's going to look different for them. So you have to take that into consideration and just prime them, give them a heads up and let them know that, it is going to look different. But listen, you need to do what your teachers are telling you to do. You need to follow these rules so that you can be a hero, right? For yourself, for your classmates. By following the rules, you're keeping yourself safe from the really bad virus and you're keeping your teachers safe. So it's about communicating on their level about the importance of following public health measures. As adults, we understand how important it is, but children, I think they need it to be reframed sometimes. And just a few last things I'll mention. When it comes to, kids, we know that they, touch a lot of things and whatnot. If your child is capable of, holding utensils, send them to school with foods that can be eaten with those utensils, forks, spoons, anything that doesn't require them to put their hands in their mouth, right? And you don't want to send them with goldfish and they'd have to, it's fine if you do, right? Because they'll end up washing their hands. But if you want peace of mind, quite honestly, it's better if you send them to school with lunches and snacks that they can just eat with a utensil, less contact between the surfaces and their mouth. And then same thing applies to clothing. If they're wearing clothing that needs a lot of zippers and buttons, teachers might be hesitant to help students with this, especially if they don't have some gloves on. So perhaps send your child with, containers and clothing and whatever that they can open and deal with on their own, right? Because that way we don't have to necessarily rely on the teachers to do this. And again, it helps limit contact between your child and everyone else.
Those are really great suggestions that you made. I especially love the no contact touching food idea. I didn't think of that. That's a great suggestion, and your strategies are. I truly agree with them. But my other concern was that with schools, the class sizes are not being reduced. We know for the grades, the lower grades. So how will children be kept physically distanced from one another in limited space in these classrooms?
So from my understanding, some classrooms will be smaller than others, some will be larger than others. Schools are trying their best to minimize the number of students in each class, but and physical distancing is going to be promoted throughout the day, right? And what's also going to be happening is that desks are going to be maximized, the space between them, and furniture is going to be moved around so that you can maximize that space that you get out of a classroom. Now, with all that being said, obviously children are children. They're going to want to play. They're going back to school, and it's really important for their, social and mental well-being to interact with each other. And quite honestly, I don't even want to think about the long-term effects of telling children to stay apart from each other for too long. And so, I think that's where the cohorting model comes in. It kind of serves a very similar purpose to physical distancing, in that it's minimizing the number of interactions that you're having, right? That's what physical distancing is all about. It reduces the number of interactions that you have. And cohorting says, okay, we're going to have 25 students in a class, and you're only going to interact with the same 25 students every single day during, class hours, during lunch, during recess. And then you're also going to be seeing very, very few teachers. So I think the hope for the government was to limit contact, for elementary school students to 50. Like they just want them to run into 50 other people during the day maximum. And then for high school students, it's about 100. So again, okay, physical distancing can't necessarily be maintained, but at least we can minimize the interactions that students have throughout the day. And we can also make sure that those interactions are safe as possible by, again, having kids wear masks, having them engage in hand hygiene, all these other public health measures that we've put in place.
Definitely, the cohorting model is one of the strategies that one can implement. But the concern with that is that you don't know whether other families of other children are practicing that. I guess that will be the major concern for parents, and that's where being a good citizen comes into play. And so the next question I would have for you is that how will the parents who opt out of in-person learning for their children be supported in online learning? And then it kind of gets complicated with parents who work either from home or in an office, and they have to support the online learning environment as well.
So for parents who opt out of in-person learning, and they've chosen to opt into online learning, the good news is, especially when it comes to special needs children, this is going to be taken into consideration in their individual education plans, right? And within those plans, they're going to consider continuing, providing individuals with access to assistive technologies. From my understanding as well, certain students have been able to take some of that assistive technology home in order to complete some of their remote learning as well. And the nice thing is with the remote learning this time around is that teachers will be going live online much more. And, as we know, obviously there's immunocompromised students, but there's also immunocompromised teachers. And so those teachers and other educational assistants are going to be teaching from home, and they're going to be teaching live, right? So the remote learning, the whole idea is that they don't want to necessarily sacrifice the quality of education for students, especially if they're doing the online learning. What's also going to be happening is that especially for parents who work from home or in an office, my understanding is that unfortunately there won't be an individual who can come into your house and provide that kind of support and sit with your child throughout the remote learning process. Again, it depends on your personal circumstances, but some families have decided to hire, for example, personal tutors or personal aides to sit with their children, but it does depend on the circumstances. And unfortunately, some people might face challenges and might not be able to bring, a personal aide home, right? Or an individual to sit with their child all day. So it's really about looking at your child's needs, considering what the school has to offer, but also being vocal about what you want to include in your child's individual education plan.
That's a great point. As you said, the needs are diverse, so you really have to assess the situation in this case. My other question, it's a sort of a follow-up question on this topic about opting out of in-person learning. So will the number of students who opt out of returning to school impact the success of the return to school program and a second wave of the outbreak?
That's a really good question. And I think, my answer to this is this has yet to be seen, right? At the end of the day, all we know is that if we follow the public health measures that have been put in place and suggested by the chief medical officers of health and public health professionals and healthcare professionals and healthcare providers, right? A lot of this work was also informed by the Sick Kids report, and a lot of school boards are doing this in consultation with, public health units in hopes that, children will have a safe return to school. Again, it comes back to each of us individually, what our personal preferences are. But I think the main hope is that everyone will follow these measures, and hopefully a second outbreak can completely be avoided. But again, it has yet to be seen. We've seen in some places, unfortunately, that the return to school has led to an outbreak. We've had cluster outbreaks. Certain classes have had to close. Sometimes schools have had to close. But we're hoping that that's not the case here.
Hopefully. And the next question for you would be that since children in elementary schools are allowed to return to school full time, what is the risk for parents and grandparents in contracting COVID-19? Can grandparents continue living with their families who have school-age children who are going to school?
So this is an interesting question because it comes back to risk, right? Like, what's your risk? If you go back to school, you're in the cohort model, but you're following these public health measures, what's your risk, right? And what I would say to that is, we are in stage 3, right? In Ontario, in Canada specifically, which means that, there is still very much a risk every time we go out to go grocery shopping, or every time we go out and interact with other people, that we might contract COVID-19, right? That risk is there. And obviously, like, it comes back to each individual in terms of how far they're willing to escalate that risk, right? If I were to stay at home and engage in remote learning, obviously my risk is going to be much lower, right? But if I choose to go out and interact with my peers and other individuals, my risk is going to go up a bit. And so to that, I say, in terms of, whether or not elderly family members should continue to live with people and family members, that is definitely family's call, right? Like, you, at the end of the day, have the ability to speak to your family physician and, again, assess the situation of that personal family member and see whether or not it's safe for your child to stay at home. These healthcare professionals, they're very willing to provide this kind of advice, and they'll be upfront because they understand your medical condition, obviously, and the circumstances. And so they'll be able to provide you with trustworthy and honest advice. Now, if you are somebody who is sending your kid to school and you have somebody at home who is, more vulnerable in a higher risk category, if you want some peace of mind at the end of the day, what I would do is ensure that as soon as your child is home, make sure that they wash themselves down, right? They're scrubbing themselves down from any trace of anything. The clothes that they've worn that day should be washed and put in the laundry right away. Anything that they've brought back from school should be disinfected. And it's just about really keeping up that culture of, public health within the house too, right? Teaching your child to continue to wash their hands and do what they need to do. And hopefully in that way, it'll also minimize the risk to some extent.
For sure. You have to educate your child that when they come back from school, if they're going to come back and not touch everything, for sure. As you said,
pick them up and you throw them into the bath.
Yeah, for sure. Those are great strategies, and also it depends, as you said, on your individual situation and how much risk you're willing to take. Because the risk is not completely eliminated at any point right now. There is always some risk, right?
There's always going to be some risk, of course, and that's what we expect. And we're in the middle of a global pandemic, and the risk will only be minimized once a vaccine is made available. And obviously that has yet to be seen. But unfortunately, every time we do step outside or interact with the outside world, we are putting ourselves at risk. But obviously that fear shouldn't hold us back completely. If we follow the proper measures put in place, the hope is that we'll all stay safe and sound.
Inshallah, for sure. So what are the resources that families can go to, like if they need, public health advice?
So I'm going to list a few, and these are always my go-to when it comes to just staying in the know in terms of public health news, but also knowing what's happening here in Ontario. It'd be really good to check out your local public health unit's website. So for example, we're over here in Toronto, that would be Toronto Public Health. You can head to their website for all the most, the most recent information on COVID-19, et cetera, et cetera. There's also Public Health Ontario. They've been doing a lot of work in terms of looking at the evidence around COVID-19. How is it spreading? Who's spreading it? Are children the ones spreading it? Is it parents? They're doing all the research behind all of this, and they're collaborating with other public health organizations on an international level. If you live in Ontario, I would really recommend you check out the Ministry of Health's website and the Ministry of Education's website for more information on the return to school. The Public Health Agency of Canada is also a great resource. I know that the Government of Canada also recently released its guidelines to going back to
Mhm.
school, so feel free to give those a perusal. There's the World Health Organization. That's also a really good resource. And I would say keep your eyes out for webinars by your local school board on safe reopening. It's really important that you enter the school year informed. That way it'll reduce any sense of anxiety you have around schools reopening, and hopefully make you feel a lot more at ease.
Thank you for all your answers. The main takeaway would be educate yourself, follow the guidelines, but make a decision based on your own unique needs. No one can tell you that this is the right answer, this is the wrong answer, because as you mentioned, everyone's situation is unique, and you need to go to your own healthcare provider for advice. We all we can do is that we can gather all the information and make a decision based on that.
100%,
Yeah.
100%. That's exactly, that would be my takeaway as well from this entire pandemic. The more educated we are on what's happening and what rules have been put in place, the better. But I also think we've done quite a remarkable job, as humans adapting to the circumstances. And I think I'm really proud of how far we've come. And I have a lot of faith that, hopefully, even if the second wave does hit, we'll be able to deal with it much better than we did the first time even.
Yeah, definitely. It's all of our contributions. We all have to contribute, wear masks, wash our hands, teach our kids, prime our kids for sure. So we have a lot of questions because the audience is super interested in what you have to in your perspective for sure. So the first question is that would you recommend homeschooling if the parent is able to stay home?
So this is all coming from my own personal opinion. I'm obviously, this is me coming from the perspective of somebody who is well versed in public health and who works and has worked in public health. If you are capable of keeping your child at home and you can homeschool them, I would say that, as we mentioned before, that would definitely minimize the risk of getting COVID-19. It might be harder for your child because they're missing out on those social interactions with their peer. But again, it's your judgment call. Like even if I tell you that this is going to minimize your risk, you have to outweigh the costs and benefits, right? Like, is your child somebody who needs a lot of social support, or are they getting enough of that at home? Is your child going to miss out on what's happening at school? Again, it comes down to you. But yeah, definitely if you were to do remote learning or homeschooling, the risk of getting COVID-19 would be much lower, assuming that you're also following the other public health measures in place, meaning that when you're going outside, you're wearing your face mask and your physical distancing, because, keeping your kid at home is one thing, but also if you're not following all these public health measures as a family, you're still equally at risk of getting COVID-19, right? So it's about keeping up with those public health measures everywhere, as we just said.
For sure. Yeah, you actually kind of addressed the next question in your answer. So the next question was, do you think that students that choose to stay home and learn virtually will have psychological effects because of lack of social engagement that would normally be present in a school environment?
I don't, to be honest with you, the research that's coming out of this, it's obviously still in the works and nothing concrete has come out of it because they're still doing remote learning and they're seeing a teacher live. And at times they're perhaps jumping onto a Zoom session and seeing their peers as well. They're still getting that social aspect. So I wouldn't worry too much about, the psychosocial well-being of the child if they're doing remote learning. As I said, the research and the evidence has yet to reveal more information around this. But you as a parent, I think you'll notice that, your child is still able to interact with their peers and their teacher and perhaps get a very similar experience as they would if they were at school.
Mm-hmm. For sure. So we just have to wait for the research from this one.
Pretty much.
Yeah. The next question is, are shields better than masks?
So that's a good question. So what we understand is that you can't use a face shield on its own. A face shield on its own is not effective, right? Because a face shield serves as eye protection. So what we know about COVID is that it comes through, it enters your body through certain like openings in your face and in your body, right? So your mouth, your nose, your eyes. When you wear a face mask or a face shield, what ends up happening is that your eyes are protected, but your mouth is still exposed. So you have to wear a face shield with a mask underneath in order for it to be effective. Otherwise, quite honestly, it's not effective on its own.
Okay. So that would be your advice. And how many masks should you send your child to school with?
That's a good one.
It's also a question. Do you pack 5? Do you pack 10? Do you pack 1?
Oh my goodness. Honestly, I think for a safe bet is to send them with 2. But also like how messy are these masks going to get? Like I would assume with younger kids, yeah, they get them pretty dirty pretty quickly. But like you can have one that your child is wearing when they go to school, and then one as a backup mask that they keep in their backpack in case something happens to that one. But generally, the idea is that if you're sending your child with one of those non-reusable face masks, you're sending them with a new one each day. You know, those blue non-medical face masks, because those ones have to be disposed of. And then if you're sending them with one that is reusable, make sure you're washing that every day as well. So I think those are being sold right now in sets of like 5 to account for each day of the week. So what I would do is obviously, again, dispose of the non-reusable ones and then wash the reusable ones. And I would probably have an extra mask in my child's backpack, just because you never know. Kids, what do they say? Kids do the darnest things. That's the saying. And I think there's some truth to that sometimes.
Yeah, for sure. No, I have lost my mask, you know. So you definitely should have a backup for sure.
We need to talk about that. I don't know how a person, a grown adult, loses their
I have lost it.
Like I have just a lot of these non-reusable ones, and they're just all over the car. And so, you know, for me, it's a matter of remembering to throw them out and then get new ones and take new ones out with me every time. But yeah, like I haven't necessarily lost a mask. I just have too many masks and I don't know if they've been used or not. So I just end up using a lot of new masks, which it's a me problem. I need to work on that.
Yeah. So the next question is it possible for not-for-profit private schools to get some public health nurses for the purpose of screening their students and conducting safety and health workshops?
Yeah, so interesting enough, I've actually been working with some local private schools on developing their public health protocols and guidelines and ensuring that it's in line with a lot of the legislation that's been put out there, right? Because at the end of the day, private schools, they're obviously, you know, they don't have to follow the same kind of protocols that public schools have. And so when it comes to public health units and accessing the resources there, from my understanding, private schools have been highly encouraged to call up public health units and ask them for what resources they can offer, and to also provide them with some insight on their back to school plans. So when you do call them and ask about those back to school plans, be sure to also inquire about whether or not you can have public health nurses on site. And if not, ask if you can potentially hire nursing students who are in their upper years and have some training for them to come in. And that's something that you could potentially facilitate on the side. So that's something worth exploring. I don't have a complete answer. Obviously, the number of nurses out there is there's been actually even a shortage of the nursing workforce, right? And now what we're seeing is that we need a lot of hands on deck in terms of the public system, but I'm hoping that some private schools can tap into some of these resources as well.
Yeah, for sure, the student nurses is definitely a great idea to tap into that resource pool for sure. The other question that another person had was that what would remote learning look like for an SK student, a senior kindergarten student?
Again, so many interesting questions. And sometimes like, I don't even know if we have the full answers to them yet. And a lot of this is like a to be decided or to be seen. From my understanding, in terms of remote learning, regardless, there's going to be a live component with the teacher. And I know that's very important for younger kids in junior kindergarten and senior kindergarten, they need that face-to-face interaction with their teacher. I've even heard of situations where students won't listen to their parents because they don't see them as an authority figure on school, and they need to actually see their teacher in person in order to feel like they, they're in school and they're doing the work. So from my understanding, remote learning will consist of very similar things that it consisted of the first time around. If you had your child in JK and they've moved to SK, I don't think it's going to be too different, but there will be a lot more in-person and live sessions. This is going to look different from school to school, from school board to school board. But the hope is that, again, they'll have enough hands on deck to provide that kind of support to students.
For sure. It may also look, different based on like the type of teacher you have. Every teacher has different engagement strategies for their students. So it really depends on the school board and the school the kid is going to. The other question that we got was related to screening. So you mentioned that there's 2 layers of screening, self-screening and screening at schools. So the question is that, are they going to be testing the kids every morning?
That's a good question. So in terms of the screening strategies, these have yet to be released by each individual school. The school boards have given much more broader strokes, and they're saying, listen, like, we will provide screening upon entering the school, and that's going to look like temperature checks potentially, right? And we're not talking about those very invasive temperature checks. We're talking about those, currently there's temperature wands or something that you wave in front of an individual and you can tell their temperature. And some of the screening is going to look like simply just asking questions upon entering. So again, if there's a public health nurse on site or other additional support, right, like administrative support or whoever else who's there to offer the screening, that's what it might look like. But I don't anticipate it looking like testing, because obviously our testing capacity within the province is also, it's being reserved to individuals who show symptoms. And when I say testing, I mean the actual test for COVID-19. And if you don't show any symptoms for COVID-19, there's definitely a trust system there that, okay, like, you don't show any symptoms, you're free to come in. If you do show symptoms, please don't come into the school and go get tested at the appropriate testing facility. So I wouldn't expect schools to have actual COVID-19 testing. It's just going to be, as I said, very surface screening, questions, temperature checks. And also, please don't just, give your child Advil and Tylenol to mask all their symptoms. I know parents might be tempted to do that. But we are entering, and this is something I should have mentioned earlier, the fall is going to be a tricky time, because the fall is also when we see a spike in flu cases.
Yeah, the regular flu.
Yeah, and even for some people, like allergies. And so if your child expresses symptoms of any sort, we don't want to assume it's the flu. We also don't want to assume that it's not the flu, right? So we have to play it safe. And yeah, if there are any flu-like symptoms, as we mentioned before, your child will most likely be sent home. And at which point it would be probably your best bet to take your child to a COVID-19 assessment center. But before all of that, obviously you would give your physician a call, and they could also give your child a proper assessment.
Okay, that sounds great. Definitely fall will be a tricky time, because I actually tend to get like the regular flu, every winter. But yeah, that will definitely be a tricky time. I think that's all the questions we had. Thank you so much for asking so many questions. And Zahraa, thank you so much for doing this for us. Your advice, it's so insightful, so informative. We all learned so much about how to sort of navigate the system. And I think that's all we have for today. And we really, really appreciate you joining us today, Zahraa. Thank you so much. My
absolute pleasure. And thank you again for having me, and all the best to all the parents and individuals tuning in. As I said, I know the fall is going to be a very anxious time for us all, but if we follow the public health measures put in place, we'll all be fine, inshallah.
For sure. And I think that we should reiterate the takeaway message. The takeaway message is follow the guidelines. Make your own individual assessment with your healthcare provider, because it's up to you how much risk you're willing to take. but gather all the information before you make the decision, for sure.
Right. And at the end of the day, parents' authority is the most important, right? You know your child best, you know your circumstances the best. So at the end of the day, it's your judgment call.
Thank you so much, Zahraa. It was
Pleasure.
really great having everyone. Bye.
Bye.